And here is your question. Right, so if you have read and understood, considering its surgical anatomization, kindly tell me, what are you looking at? There are certain marked structures. Would you be able to identify from 1 to 13, please?
Yeah.
Just one.
Yeah, one is the posterior belly of the digastric.
Okay. 2, please.
2 is the anterior belly of the digastric.
Yes, in between 1 and 2, actually, if you look closely, 2 is here. It's a space. What that is?
Okay, that the space in between these 2 is the digastric triangle. No, carotid triangle.
Okay.
That's carotid triangle.
What is 3 here?
3 is the posterior triangle, the superior posterior triangle. Yeah.
Okay. Which is number 4, if you can identify?
4, I'm trying to look for where 4 is in the
4 here.
4 is the sternocleidomastoid.
Very good. Okay, this sternocleidomastoid muscle, can you please tell me the attachments of it?
Yeah, the attachment of the sternocleidomastoid, it arises from 2 heads, the clavicular head and then the sternal head. The sternal head arises from the upper part of the sternum, that's the manubrium. Then the clavicular head arises from the medial part of the upper border of the clavicle. Then the superior attachment is to the mastoid process.
What are the nerve supply of the sternocleidomastoid muscle?
The nerve supply to the sternocleidomastoid is the accessory spinal nerve.
Yes. What are the function of this muscle?
The function of the muscle is when acting unilaterally, it helps to rotate the neck laterally. And when acting in consonance bilaterally, they help to stabilize the neck, and they could also contribute to flexion of the neck at the atlanto-axial joint.
If I ask you, if you can tell me quickly, how the triangles of the neck are divided?
The triangles of the neck are divided into anterior and posterior. The major muscles that divide it are the sternocleidomastoid, which divides the anterior and posterior, and posteriorly is the trapezius muscle. And
can you please tell me how many triangles there are present anteriorly?
Anteriorly, there are 6 triangles altogether. On both sides, we have the muscular triangles, the carotid triangle, then the submental triangle.
Anteriorly, there are basically 3 triangles. Here, if you can identify number 8, which triangle is this, please?
Number 8 is the muscular triangle.
Okay. And number 13 is which triangle?
Number 13 is the digastric triangle, or the submandibular triangle.
That is more commonly it is called. Okay, can you tell me how these triangles are divided?
Yeah, the triangles are divided by the sternocleidomastoid posteriorly, the anterior border of the sternocleidomastoid.
Anterior triangles.
Anterior triangle, yes. So in sternocleidomastoid posteriorly, then anteriorly the anterior belly, posterior belly of the digastric, and then the homohyoid muscle inferiorly forms the borders of the carotid triangle. Then the submandibular triangle medially is formed by the anterior belly of the digastric, and then posterolaterally by the posterior belly of the digastric, and then on the lateral aspect is formed by the mandible.
Okay. What are the contents of the posterior triangle? Here, if you could see, the posterior triangle are again divided into two. What is this number 5 dividing these posterior triangles?
The number five is the omohyoid
Okay.
muscle.
So what are the contents of this number 3 and 7?
The contents of the posterior triangle of the neck include the muscle, that's the omohyoid muscle. Then
Yes.
the nerves, there is the accessory spinal nerve, and then
Yes.
there is also the branches of the cervical plexus. Then there are also lymph nodes in there, and there are blood vessels. The blood vessels are transverse and cervical, and then suprascapular arteries.
Good. Can you identify number F here, please?
Number F is the right lobe of the thyroid.
Okay, and E, please?
E is the isthmus of the thyroid.
All right. Can you tell me the extent of the thyroid gland?
Yeah, the extent of
the attachment, yes, or the surface anatomy, in other words, of the thyroid gland.
The surface anatomy of the thyroid gland, it extends from the level of the thyroid cartilage down to the level of the cricoid cartilage. The isthmus is at the level of the 2nd, 3rd, and the 4th tracheal rings.
Okay. Can you please tell me what is the blood supply of the thyroid gland?
The blood supply of the thyroid gland, the arterial supply is from the superior thyroid artery, which is a branch of the external carotid artery, and then
Yes.
the inferior thyroid artery, and then the superior thyroid artery, which is a branch of the thyrocervical trunk. There's also a small artery called the thyroidal ima artery. The venous supply or the venous drainage is from the superior thyroid vein, inferior thyroid vein, and the middle thyroid vein.
And the venous drainage?
The venous drainage is from the inferior thyroid vein, which joins into rubricocephalic vein, and then the middle thyroid vein and the superior thyroid vein, which drain into the internal jugular vein.
Very good. And the lymphatic drainage goes through? Yes.
Yeah, the lymphatic drainage in the thyroid gland drains along the blood supplies to the deep cervical group of nodes, and then also to this cervical group of nodes principally.
Can you identify number D, please? If you can see, please. Yes.
D
Okay.
looks to me like the clavicle.
Yes, very good. It is clavicle. Yeah. All right. Can you see this image? Here 8 is clavicle. And if you can imagine what this blue would be, number 14, if you can identify.
Yeah, the blue structure is the external jugular vein. All
right, good. And what is this red one, if you can identify?
The red one is the
manubrium. It's vessel.
No, it's the internal carotid artery.
22, yes.
Yeah.
Right. And this structure 5 is which structure?
This one like the thyroid gland.
Very good. Okay. Can you please identify, if you can identify, all right, what is this 29?
29 is the brachial plexus. The trunk.
Very good. Okay. Which vessel, which structure, not vessel, which structure would be this? 1.
Structure 1 is likely the spinal accessory nerve.
Okay. That was it. And within time. Good. Thank you.
Yeah, thank you, ma'am.